So Hotel du Hospital in Kingston, which is an ambulatory care centre, is identified under the French Language Services Act, which means that we are working toward improving our services in French in health services. And so one of the first steps that we needed to accomplish was to identify which members of our staff had capacity to provide care or service or even to provide conversational French. What we've been doing is we've actually contracted with a third-party firm that we offer free language testing for any staff who is interested. We've asked people to volunteer to come forward and have their testing done. Takes about 45 minutes, happens on the telephone, so our human resources department books an appointment with someone who does a progressively more difficult test in French to really assess people's oral French language skills. The hospital covers the cost of that so that we really have an understanding of who can provide what levels of care or service in French. And it also is useful for us to test people because people who qualify as having a base level of French can actually apply for funding to improve their French language skills, but we need to know where they're starting from. So far, we have had about half of our staff come forward and undergo the testing. The nice thing about it is, for someone like me who did immersion in school, it's been helpful for me to understand what my current oral level of French is, and so it encourages me to use it. It gave me confidence knowing that I actually test at a very good degree of French. And for a lot of our staff who are really interested in speaking French, again, it gives them that confidence that they actually have more capacity than they realized, which is helpful.